Hello, I'm Dr. Anthony Colantonio, and I'm here to discuss with you how you can prevent complications when certain necessary medical procedures are performed. First, I would like to bring to your attention 3 complications that are infections that should not happen while you are hospitalized. Some insurance companies don't even reimburse the hospital for the care you receive should you get one or all of these complications. If you get one of these infections, the hospital may not bill you for these infections because insurance companies view these infections as the hospital's fault. Please see slide 1 for a list of these infections, which includes number 1, central line bloodstream infections, number 2, urinary catheter associated urinary tract infections, and number 3, ventilator-associated pneumonia. Let's take these one at a time. Number 1, central catheters are intravenous catheters that are placed in a large vein on the side of the neck or into the chest vein just underneath the collarbone or in the large vein found in your groin. These catheters are most commonly placed at the bedside under local anesthesia and must be placed with sterile technique and dressed well and dressed properly for the few days that they remain in the vein. These catheters should be placed with the assistance of ultrasound guidance to make it easier for the doctor to find the vein and not have to puncture your skin more than once. It is either a break in the sterile technique or poor wound care of the catheter on a daily basis that infects the catheter and infects the blood, thereby placing your life at risk. This infection should not happen. The doctor must follow a strict, sterile technique when performing the procedure. The nurse must be very careful every day and every shift when observing and changing the bandage dressing of the catheter. But if the infection does happen, neither you nor your insurance company has to pay the bill for all of the care that follows as a result of that infection. Keep that in mind when the hospital asks you to pay your share of the bill. Be sure they are not charging you for an infection that they have caused. Careless health care is one of the reasons why our health care costs are so high and continue to increase. And careless health care is also the reason behind many injuries and many deaths. These infections cause bacteria in the bloodstream to spread to all parts of the body, and 1 out of 5 patients who gets this infection unfortunately dies. And this infection alone, the infection from central vein catheters, is responsible for over $3 billion every year being paid by Medicare. The infections must stop, and when they occur, the patient should not be held responsible. Every day, there is the equivalent of an entire jetliner full of patients that dies from healthcare-related problems. Just think about a jetliner crashing every day and everyone on board dies. Every day you wake up and on the front page of your newspaper is a report of a jetliner full of patients that has died. I'm sure that would make you sick to your stomach and make you ask yourself, when will I be on that jetliner? Well, that jet crashes every day, and every day over 400 people die from hospital-caused problems. That number is astonishing, and the only way to lower that number is for patients to get involved, for patients to report problems and complain, and for the healthcare field to be held accountable. Let's return to our slide. Number 2, urinary catheter-associated urinary tract infections are also preventable, and it is up to the hospital personnel to stop these infections. These urinary catheters, used to drain urine when a patient cannot get out of bed, when they do get infected, are due to the poor sterile technique by the personnel inserting these catheters. They don't follow the proper protocol. It has been shown that the rate of urinary tract infections is related to the number of nurses taking care of patients. As the number of patients that one particular nurse is taking care of increases, the risk of urinary tract infections increases. These infections can be life-threatening and should be avoidable. Also, these types of urine infections are on the non-payment list, and neither you nor your insurance company is responsible for the cost to take care of these infections. And finally, number 3, ventilator-associated pneumonia. Pneumonia associated with the use of ventilators is also usually avoidable and due to 1, poor oral hygiene care, number 2, improper use of suctioning and suction tubing, number 3, poor patient positioning, and or number 4, the lack of pulmonary care. In addition, patients are kept on ventilators too long. Many times, patients are not taken off of the ventilator after a certain hour of the day. Hospitals must begin to have more physicians and more nurses available. You must advocate for your loved one and complain when you see something being done improperly. Start by complaining to hospital administration, but also complain to your local and state health departments. All of those phone numbers may be found on this website. If you would like to call me for help or for advice, please call my toll-free number 855-832-5757. The call is free. The advice is free. Just remember to ask for me. Ask for Dr. C. Thank you very much.